All right, good morning, everyone, and welcome to the first of 6 business information and listening sessions presented by the Wyoming Business Council. I'm Warren Appel. I'm going to cover a few housekeeping matters before I hand you off to Josh to introduce our agenda and panelists for this session. Written questions may be submitted using the Q&A function on the webinar toolbar. We will share these with the panelists as time allows, but please do not submit questions via the webinar chat box. These sometimes get missed. Individuals wishing to speak or ask questions should utilize the raise hand feature on the webinar toolbar that helps us keep things nice and orderly. Please keep your microphone muted at all times when you are not speaking and keep background noise to a minimum. This is a courtesy to all participants and will help ensure we have good audio on our recordings. Yes, we are recording today. We will make these recordings available on our website, wyomingbusiness.org, as soon as possible. With that, I will hand you off to Wyoming Business Council CEO Josh Durrell to introduce our speakers and agenda.
Yeah, thanks everyone for showing up this morning. I know it is a short notice and we really appreciate the number of folks who've come out today to understand some of the changes that are coming down the pike on May 1st. We know that many folks would like to see more change and some people would like to see less change, and it's a challenging time for everyone. And I think we just need to recognize that and recognize that there are many good people working very hard on this challenge within the state agencies, and we've got a number of them today. But I just want to make sure everybody understands that, you know, balance that is what we're trying to achieve, and we're really trying to balance the lives and livelihoods of Wyomingites, and it is a big challenge, and I want everyone to also remember that we will not be necessarily back to normal anytime soon, and that's going to be we've heard the term new normal. We've heard, you know, what it's going to be like in the next few months or years. But what I want everyone to remember is that we're going to be driven by the health metrics, and Stephanie Pyle is on to walk through some of those. And I think we also need to understand as business owners and business people that we need to help our customers with their expectations. We also need to make sure that we work collaboratively with them and do our best to continue to serve them, while at the same time making sure that public health is in the front of mind. And so I think that balance is what we're trying to achieve. And I think with our customers and with the businesses around your communities, encouraging that spirit of collaboration and creativity in order to get through this is really key. And so as we talk through these, you know, we'll be opening things up at the end for a question and answer session with our experts here. And you know, please also know that we're here and we'll show you some ways to contact the Wyoming Business Council toward the end of the show as well. Today we have, I know we have Stephanie Pyle on the phone. She's a senior administrator for our public health division at the Department of Health. We also have Corin Schmidt, who's the senior administrator for, excuse me, I've got that wrong. Corin, you are with the Department of Family Services. I have that wrong right there. So we've got a couple of folks here that can help. I believe we'll have Sharon Bennett and Stefan Johansson, if they're able to join, in order to answer specific questions around the opening of barbershops and beauty salons. And perhaps Stefan to answer any questions on the health side. He's been deeply involved in all of the health decisions and metrics there. So we've got a great panel of folks here, and also just to let you all know, we'll be doing this webinar session 5 more times this week at 8 a.m. and noon each of the 3 remaining days of the week, so that if there are people within your communities, your business communities, or you want to check this out again, you can do that and ask more questions and get answers as well. So with that, we'll take a quick look at what we're going to cover today. We are going to take a look at the health metrics. That's again, that's front of mind for all of us, and it should be. Those are going to drive our decisions. And while we do want to ease into and look at opening things up a bit, we also realize that if those metrics change, we may need to pull back. And I think we all just need to recognize that this is a time when it's not just a one direction. And so we'll let the folks from the Department of Health talk a little bit more about that. We're gonna show some of the businesses that are still open and have always been open, and that's one of the great things about Wyoming. I think there have been like some other states that have really locked things down, we've remained, some of our businesses have been able to remain open, and that's been very helpful. Corin will talk a little bit about childcare. We'll talk about restaurants and dining, the changes there, gyms and fitness centers, personal services, and then we're also going to talk a little bit about the variance or exception process that is possible now as well with your county health officer. So we're going to go ahead and with that, we're going to jump in and ask Stephanie to talk a little bit about the health metrics and make sure that everyone understands how those work. Stephanie?
Thank you, Josh. Good morning, everyone. Thank you so much for being on the call today. I first want to acknowledge, what a difficult time this is for everyone. In a matter of months, our lives have been turned upside down, and we are facing challenges that we never thought we would see in our lifetimes. And that is both from a health and an economic perspective. And I just want to acknowledge that for all the residents of Wyoming, and obviously around our country as well. We've been working diligently since before this started, truly, to be prepared for this and to do what we can to protect the public health of the residents of Wyoming, and obviously trying to strike a balance with protecting the public health and still allowing things to operate to the greatest extent possible. So many of the things that Josh said, I would echo and just let you know that we continue to work night and day on these issues and truly trying to make the best decisions that we possibly can. And we've appreciated the partnerships that have quickly been developed, for example, with the Business Council. We have great support from the governor and many other state agencies that we continue to work with on a daily basis. So what you're seeing on the screen right now is what we've started referring to as our dashboard. And you'll see statewide metrics here. And as we move into easing restrictions, we need to do so in a data-driven way. And while we would all like to have, things end, the closures completely end and open, that is just not a safe thing to do from a public health perspective. And so we are hesitant, and we have not chosen to open on a date or to ease restrictions on a date, but rather to say, what are some of the key metrics that we need to see so that we will know when it's the right time to ease restrictions and how we can do that in a methodical and thoughtful way. So the metrics that we are looking at in part are displayed on your screen right now. So we will be looking at the number of new cases. Have there been fewer cases over time? And for those who are tracking each day, you will see that over the past several days, and each day we continue to have an increase in cases over time. So that's the justification or the reason for that metric being concerning, because we're not seeing it stabilize and we're not seeing it improving at this time. The next metric on this dashboard is percent of cases attributed to community spread. Is that percentage the same or less? And you'll see that that metric is currently marked as stabilizing. And this is the number of cases where we can't necessarily tie it to a traveler or tie it to a specific person. This may be a person who's never been, perhaps not been out of the state recently, not been out of the country, and not been around someone who was sick. So this number, we really want to see that improving. We want to see fewer cases attributed to community spread so that we know where COVID-19 is originating and how to best control that. The next metric that you'll see is percent of all tests that are positive. Is this percentage the same or less? Again, this is stabilizing. Currently, we're at about 4% of all tests that we conduct that are positive. And so we want to see that number stabilizing, as I said, or of course, improving. And, the question comes up, are we able to test enough individuals? And that's a national concern, that we're not able to test as many people as we need to and as we would like due to the shortage of testing supplies. So that's a difficult number to to monitor and keep an eye on, but we are looking at that and seeing where that trend goes. The next set of metrics has to do with hospital capacity. And so the first one here, total COVID-19 admissions reported by hospitals. Clearly we want to see this number improving. And that will tell us the severity of the cases and the positive COVID-19 patients. And we definitely want to see this number going down. So the next one, total hospital bed availability, is bed availability in Wyoming hospitals stable. We want this number to be moving in the right direction in the event of a surge so that we have enough hospital bed availability. And this directly ties into the next one, the ICU bed availability. It's critical in these times that we have enough resources. And so we're keeping a very close eye on this, with hospitals reporting daily to us on their current usage of hospital beds and ICU bed availability, because this is something we really have to keep a close eye on in the event of a surge in any county and or within the state. So we've developed these metrics. This is kind of a high level overview of all the metrics that we look at. We have more details that we're working with specifically from county to county to help them understand their county specific metrics. And we'll get into that a little bit more as we go, about some of the county specific things that we're keeping an eye on and how that looks and how it's different from the statewide perspective. But that's sort of a high level overview of the metrics that we're looking at on a daily basis statewide.
Thanks, Stephanie. That helps a lot. And again, we'll continue to monitor this. And this is something that I think those of you who have seen the governor's press conferences are becoming familiar with over the last few, and it will be something that will continue to roll out. So thanks again, Stephanie. Appreciate that. And we'll go ahead and move on to the next portion here. One of the things that we did want to highlight, and this is something, it's a bit of a call to action for those of you who are out there in the business community. It's also something that we wanted to highlight from a new technology point of view. One of the things that we developed at the Business Council, along with a partner, was a listing of all of the businesses and their potential changes in hours and services because of COVID-19. And so this, if you go to wideopenyo.org, you will see basically a map where you can zoom in, you can search, and so people will be able to see this. And one of the things that we wanted to make sure that people understood is that there are a number of businesses open. There are ways to get the services we desire, and albeit changed, there are many places that are available to buy things, to eat, to drink, those kinds of things. So we wanted to make sure those were available. But at the same time, we are making a call to action to those businesses out there to go to this site and log in and update your information, and take this time as well to make sure that your updated information is out there on Google, your social media. I'm sure you're all doing that, but it's just a good time to make sure that any changes in your service offering or hours are reflected so that people can find you and make sure that they can connect with you. So that's something that is happening right now, and so you can go check that out anytime. Now we're going to dive deep into the changes that are coming up May 1st within the various orders. And we're going to focus today on orders 1 and 3. Those are the two orders that really kind of impacted and taught businesses the guidelines for operations over the last month or so. And so with that, Corin, I'm going to have you talk a little bit about childcare and the changes, or Nikki, the changes that are under Order 1 coming up May 1st.
Good morning, everyone. My name is Corin Schmidt, and I'm with the Department of Family Services. And childcare has been an interesting function in all of the COVID. As many of you may know, childcare did not completely close. Childcare was left open to serve the families and children of essential employees. So in terms of opening or expanding childcare, there's some guidance that's on the page in front of you. And I do want to quickly point out a typo in A. It says each room may only have groups of 10 or fewer people. That should read 9, and that change will be updated. But what the major change to childcare has been through this particular order is expanding who it is that can participate. or who it is that you can serve. So childcare centers can open or expand capacity with all the provisions that are in the health order. We're recommending or encouraging you to contact your local county health official if you have specific questions about the application of either the state health orders or any local health orders that have been put into place. What's important about this is that essential employees are still the priority population. We do need to keep our healthcare centers running, our food supply chains, all of those important elements that have been in place. Those still need to be supported. However, this does give you the chance to start to slowly take in with a lot of thinking and emphasis on the safety of children and the safety of staff to be able to serve families for example, the other populations that I think we'll be discussing in a few minutes. Some important things to note: if you are a child care provider, your licensure is available for technical assistance. We understand that the provision of the state health orders are different than the licensing requirements. And so if you have some questions about how the two of those mesh in terms of, for example, ratios, staff to children ratios, please contact your child care licensor, and we will work through the regulatory part of the child care licensing rules, and then in addition to helping to understand what maybe the application of the health order is in regard to the 9 or fewer people. We appreciate child care centers who have already, who have remained open. We have about 45% of our capacity of already opening. So I think this transition will be maybe a little smoother for some because they've already been functioning. However, for some of our others, it may take a little bit more orientation around the safety part, the sanitation, some of the population regulation in terms of who's coming in the building, who's coming out of the building, and a variety of other questions. So we're excited to see this part of our infrastructure expand, but we also want to emphasize that we still need to do it very carefully, safely, understanding that the population, these children are a vulnerable population in regard to just have no control over their own situation. And so certainly we as adults need to keep that in our mind as we move forward with slowly developing and expanding capacity again.
Thanks, Corin. And we did have a couple folks chat in, and I appreciate you doing that right now to maybe enlarge the slides. And I guess the intent here is to give you an overview of what these are. We do have a link at the end of the slide presentation to the governor's page with all of the orders that are listed there. And so we'll be able to kind of talk through these things now, but then toward the end, you'll see a link for the actual order that is available through that COVID-19 website. So we'll get to that here shortly. And I also see some questions are coming in, which is great, and we'll address those toward the end. But thanks again, everyone, for letting us know and what's happening, and hopefully you're getting your questions answers as we go. But if you're not, we'll answer them at the end. So with that, we'll move on now to restaurants and dining, and I'll talk a little bit about that. The changes that are here, as most restaurateurs know, that things were available for takeout only and being able to be curbside delivery. Now that has changed a little bit to allow up to 5 members of the public at one time. And I'm also going to ask for Stephanie to talk through a little bit on the logic behind this. I know there were some, that restaurants can present a large group gathering challenge, we'll call it. And that is definitely one of the major causes of the spread of this virus. But I'm definitely not a doctor, and so or someone in public health. So I'll let Stephanie talk a bit about this one if she could.
Sure, Josh, thank you. So as we ease restrictions here in Wyoming, I mentioned that we want to take a very measured approach. And when we look at one of the main ways this disease spreads, it is through larger public gatherings. And so as our state health officer considered what direction to go in terms of easing restrictions, it made the most sense to focus that on the small steps and incremental steps we can take where there are fewer people gathered in a group. And so that's why you see the changes that have been made in terms of the gymnasiums and the personal services that can be offered. Those are ways and situations where there are not large group gatherings. Those are very controlled environments, and there are ways to track who might have been present in a given setting should there be a positive and should contact tracing be necessary. And in the restaurant setting, that would certainly be more difficult, and you would definitely have more groups, more larger gatherings, and certainly more contact where people may be coming into contact with someone who is positive, and that would cause the disease to spread. And so we're trying to do this in a very controlled manner so that we can really keep an eye on who were the people there, making sure that those individuals were taking the precautions of the face coverings and things along those lines. So that is the reasoning behind the method that we're using to ease the restrictions and to stay away from the larger gatherings that could potentially lead to more community transmission. Thanks, Josh.
Yeah, you bet, Stephanie, and thanks for that explanation. And I know that this one can be a little bit challenging, but I think that taking a look at that explanation and understanding the logic behind it definitely helped. So thank you for that. I sure appreciate it. All right, we're going to move on now to gyms and fitness centers, and we'll talk a little bit more about this one. So I'm gonna basically read through these. I am not a gym owner. I've seen the inside of a gym from time to time, and rather enjoy those places. But with no representation from gym owners on the line today, I'm going to take care of this one and walk through it, and then we'll talk about and again, if Stephanie wants to pepper in any kind of health perspectives in this, I would welcome those comments as well. So, taking a look at this, I think there are some key components here. Staff wearing face coverings at all times, and making sure that that no staff member or employee that has symptoms can do work that day, and making sure that we ask them to go home and get better. The close contact activities. These are some of the things that maybe you're used to doing as a gym owner or as a trainer, but are really kind of challenging in this setting. So no close contact activities, and that means one-on-one personal training or weightlifting with spotters again. And then locker rooms where people can congregate are remaining closed. Workout equipment needs to be spaced out so that it is no less than 6 feet apart. And it needs to be cleaned by staff between usage by customers. And I do see one thing, Stephanie, and this might just be an implementation detail that's important, but can you talk a little bit about putting that on staff rather than the individual gym member for that?
Yes, Josh, and you're talking about the cleaning in between use?
That's correct.
Okay, yeah, thank you for mentioning that. Clearly hygiene and sanitizing is one of the most critical ways to stop the spread of COVID-19. And we want to ensure that this is done properly, thoroughly, and staff members in gyms have been trained on proper cleaning techniques. And so we really want to make sure that this is key to keeping that equipment clean and sanitary for the next user. So we want to rely on staff members to carry that out.
Yeah, and I think again, keeping in mind the social distancing, the number of folks that are available or that are allowed in a certain area, I think that drives a little bit of the group workout classes and how they're prohibited, at least in the general order here. Making sure that we have plenty of social distancing and spacing there. I think this is another thing that is something that many gyms already do, where they're tracking a record of customer usage, date and time, and making sure that people are checking in, checking out, and knowing who is there in case contact tracing is important. And then I think there's some calculations that you can do for the square footage of your particular gym. Again, I think swimming pools, which I believe were closed before, are now open to 1 swimmer per lane. But spas and saunas must remain closed. And we did get a couple questions about the gyms, and about the idea of submitting a plan. And we'll talk about those exceptions and variances later in the slide presentation. But I do want to mention that, if your gym meets these requirements, and Stephanie, you can back me up here. If your gym meets these requirements as it is, then no other exceptions or variances would need to be worked with the county health officer on. Is that correct?
Yes, Josh, that is correct. So if we have a gym owner or manager who's looking at this and saying, I can carry all of these things out starting May 1st, I can put the appropriate restrictions in place. My staff are trained to do this. We'll be taking all of these precautions, then you're exactly right. They don't need to submit an exception request in order to start operating on May 1st.
And I do see some other questions, but we'll cover those in the Q&A, because I do think those are really important for people to talk through, and again, I think address them exactly as they're written. So Stephanie will do that here in a few moments. Okay. All right. Now, I did see Sharon Bennett was able to join us. Sharon is the Executive Director of the Board of Cosmetology, and she will be able to talk a bit about the personal services that are changed under Order 3. I think this one represents probably one of the biggest changes here. And so with that, I'll turn it over to Sharon, if you don't mind.
No, can you hear me?
Yeah, you're a little faint, so maybe speak up just a touch.
All right, we've been having little technical difficulties this morning. So I'm not, I think I'd probably be better to wait and address any individual questions. We have this information posted on the webpage for our licensees as far as the order and the main piece of this that they'll have to adhere to get reopened. We're also going to be putting out some suggestions for reopening. We just need to make sure everybody realizes that this needs to be done very carefully. So they're welcome to call my office, and we'll get more information out there probably before noon.
That's great, Sharon. And I think it's really important to realize that I think there were probably a lot of guidelines for folks in these industries as anyway, but it's really important for those business owners to fully understand the changes that are being made, and work closely with Sharon and her team to answer any questions that you might have specifically. But again, if there's some guidance coming out before noon today, make sure you check on that. I think that's great. And again, making sure that that Sharon is and her team can help you out as much as possible. So thanks everybody for taking a look at that one. And thank you, Sharon.
You're welcome.
All right, now, one of the big questions that we've had already in our question and answer, as well as I know I took a number of these calls yesterday, was this whole idea of a variance or an exception. And I think it's important for us to understand this process and know what it means. And again, I'll rely on Stephanie a bit here, just to kind of help walk through it and clarify anything that's necessary. But Stephanie, I just want to make sure that this is correct, that if you are able to operate your business within the guidelines that were already laid out in the orders, there is no need for an exception or variance or anything like that. And they can begin to operate with those guidelines in mind. Is that correct?
Josh, you are correct. Effective May 1st. And so let's back up for a minute. If a business can operate under the current statewide orders, which remain in effect until tomorrow, then they can certainly continue to operate as they have been under the statewide orders. If a business can continue or begin to reopen under the statewide restrictions that start on May 1st, they can do that without any exception request or variance request at their county level. So, keeping those restrictions in mind, if they can run their business with those restrictions in mind, they can operate under the current statewide orders or the ones that take effect on May 1st.
Great point, and those dates are important. And you do have if you're not currently operating, or the new guidelines will allow you to operate in this capacity. Having a couple days to make sure that you can do that is really important. And I think it's probably and Stephanie, I'm sure will back me up on this. It's really less about the date and making sure if it's after May 1st that you're doing it correctly, right? So if it takes you a few extra days to make these changes, that's what's important, and we want to make sure that public health is at the forefront, and thinking about post May 1st, making sure that you can meet those guidelines. And then in those instances, and we've seen a couple of them come into the Q&A already about trying to understand a variance order or exception request. And again, I think that some of these terms can be a tad bit confusing, but we'll walk through them at a high level. And again, I think I'll have Stephanie help me out with these as well. I think Stephanie probably understands this process better than anyone on the panelist crew right now. So Stephanie, do you want to just kick us off there?
Yes, absolutely. Thank you. So understanding that the health metrics that we're looking at are not the same for the entire state. We have counties that vary in where they are with those metrics that we went over at the beginning. So understanding that and knowing that individuals at the local level have the best information in terms of the data that they receive from us and knowing their county the best. So what options are available are a county can request a variance. And so if you think about the statewide orders that are in place, when we're talking about a variance, this is where a county says, we want to vary from that statewide order in its entirety. And here's why, and here's what we want to do. And so if you think of the variance as varying from the statewide order in its entirety, that's what we mean when we say a countywide variance. And so under those circumstances, what we would like to see is local discussion on how that county will vary. So for example, will that county be less restrictive or will they be more restrictive? And we do have some counties, I should say a county, that wants to be more restrictive due to the conditions of their outbreak. And so Teton County wants to keep their more restrictive order in place. And this is an example because none of these things are finalized in terms of county specific orders. But let's just say, for example, Teton County says, we want to keep our order more restrictive because of the circumstances of our community, our health metrics. We think it's appropriate to keep in place the order that we already had that was more restrictive than the statewide orders. That would be an example of a countywide variance that's more restrictive than what we have. We may have another county, for example, where their metrics, and looking back to the dashboard that we showed at the beginning, maybe their metrics are such that they can ease a little bit more than the statewide orders. So they would request the variance to ease restrictions a little bit more based on all of that data. So that is the countywide variance, countywide. Now, when we're talking about exceptions, this is where we're talking about more individualized businesses or perhaps types of businesses in a limited manner, where that business owner may say, I've come up with a plan that meets the social distancing requirements, that meets screening measures, that meets the ability to do contact tracing once, if there is an outbreak in my establishment. And so I, as a business owner, am going to talk to my county health officer about that exception and see if I can get that exception approved. Now, those are the two distinctions between what is available to operate in a way outside of the statewide orders. Both of those processes have to go through the process that's outlined on your screen. And so the county health officer has to approve or deny the request or approve the countywide variance. Once the county health officer does that, then that county health officer will talk with our state health officer to say, here is either the countywide variance we want to do, or here is the exception we want to request. They talk about that. And then if that's approved, then we will issue either a countywide order for the whole county or the exception request for that particular business or activity that will fall outside of the statewide order. We do that in conjunction with the Attorney General. We do that, talking through what are the specific plans, what are the guidelines that will be in place in order to do this. And, we do that. And as you can imagine, this will elicit complaints either way. If we have a process where the county says, this is all falling on us, which we're trying to make it not fall on anyone, but rather doing this together in collaboration. The alternate would be the state decides all of these things, which we don't think that's appropriate either, because we want to maintain as much local control as possible. So those are the two options that are available. If for some reason the statewide order is not the best for the county, and so we want, as I said, we want those conversations to be taking place at the local level, whether it's through the county health officer and local officials or local businesses to reach out to their county health officer and walk through this process if it's an exception. And so I hope that that's not confusing. We're trying to see this as two distinct things, one for the whole county, one available for specific businesses or activities, and really keeping those local conversations going where we think the best decisions can be made in conjunction with the data and talking to us. And so Josh, I hope that helps with that process.
Yeah, it definitely does. And I think it's one of those things where it can be, it could be a little bit confusing at first, but the bottom line is that there are a couple different levels of variances, or there's one level of variance at the countywide level, and there could be exceptions at a business level, or specific examples. But the bottom line is working with your county health officials, working with the state health officer, making sure that again, these things are health top of mind, and thinking creatively about the ways to do that and to ensure that your patrons are safe, but at the same time being able to run your business, I think is the key here. And while we cannot, it's pretty challenging to put out rules that fit every nuance and every situation. That's why this process is in place and available to businesses. And with that, I think that covers some of the bulk of what we want to talk about today. And with that, we're going to go ahead and get into the questions and answers. And I know that, having the experts on the panel is really important, but we do want to let you know a few things. One, making sure that that the Wyoming Business Council and your regional director that is out there for help or contacting us directly is always somewhere you can start. We have access to a number of organizations around the state that can help you, from the Small Business Development Center through the university and the SBA, or a number of local economic development organizations in your chamber. Also, getting more information on COVID-19 and how it affects you. We've got a website there. And then finally, the complete public health orders are available on the covid19.wyo.gov website so that you can see them there and make sure that you read through them carefully. So with that, I'm going to open it up and turn it over to Warren, our facilitator extraordinaire, to go through some of these questions. Warren?
All right, thank you, Josh. And just as a reminder to all participants, you may submit questions using the Q&A tool. That is the preferred method that helps us keep track of them there. You can also, if you'd like to ask a question live, you may use the raise your hand feature. We will get to you and call on you as time allows. I'm going to get back to some early questions. Are there specific requirements for licensed insurance agents to return to our practice of calling on new and existing policyholders at their residences and businesses?
Warren, can you repeat that question, please?
Absolutely. Are there specific requirements for licensed insurance agents to return to their practice of calling on new and existing policyholders at their residences or businesses?
And Josh, maybe you can help me out with this one. Were there restrictions? I'm not thinking of an order provision that would have restricted this up to this point? Are you aware of something from another source that would have restricted this?
Yeah, I don't, and so I guess it would be that business would still be open, but I think that there are the social distancing aspects, obviously, and those kinds of things. But other than that, I believe that those businesses, based on the order, should have been able to operate as long as they're keeping those social distancing and large crowds, large venues of less than 10 people. So,
Agreed.
Next
Okay.
question. I am the owner of a performing arts school. Primary classes are dance and music. Our students range in age from toddlers through adults. I can't get an answer about what category my business falls in. We were never given a mandate to close, but voluntarily discontinued on-site operation on March 14th. I am not clear on what guidelines we need to follow for reopening.
All right, Leslie, thank you for that question. And so I'm reading through your question right now and thinking about which provisions of which orders may apply. And so certainly order number 2 would apply in terms of gatherings. And so of course we know that's limited to less than 10. And your question is no longer on my screen. So I do think that those provisions would apply. In terms of the offering that you have, it may be difficult to maintain social distancing, or you may have a plan where that could be achieved. And so I think we might want to talk offline a little bit on this, just to talk through some of the specifics of your situation and then where to go in terms of, if you have a plan and contacting your county health officer. So Warren, if you want to put my email address up or my phone number, I'd be happy to talk to people. We may not be able to answer all of the questions in this forum, and I want to make sure that we get those questions answered to the best of our ability. Also knowing that the best way to answer many questions would be to contact the local county health officer. But for some of these where we need to identify a starting point, I'll be happy to talk with the person offline. So I can put that up in the chat if I need to, Warren. Thank you for doing that. And my phone number is 777-7958. And so Leslie, please feel free to reach out to me after the call and we can talk through some of these things and I can point you in the right direction.
I have a question for DFS. How do you keep a face mask on a 2-year-old? I am afraid this will be more frightening than helpful.
Thank you, Warren, and thank you for the question. Yes, this is where this balance is going to come in. The guidance document says to the best that you can, essentially understanding that when childcare centers, you're going to have difficult populations. I mean, you're going to have small children who are not going to understand. I think really the idea is to do the best that you can to keep everyone safe, understanding that there's going to be some situations where you're not going to be able to don face masks for children. But I think also enlisting the support of parents is helpful, and help in asking them to reinforce maybe face mask wearing at home. It is an option, but it is going to be tricky, and there's going to be some gray in some of these situations. Just to get ahead of the questions a little bit, what we have learned is that many of our childcare facilities that have stayed open have come up with some pretty cool ways to keep children safe and some things they've learned along the way. So I encourage you to contact your licensor, and the licensor can connect you with another childcare operator that's already gone through a lot of the logistics of this guidance, and certainly available to brainstorm with you, because every situation, every center is going to be a little bit different considering square footage and size. If I could, there's a good question in there, Warren, about size limitations. May I answer that as well?
Absolutely.
So the question is about, if I have 9 kids in a preschool, am I good? It's not a matter of 9 children, it's a matter of 9 people. So you have to take into consideration any of the staff that are also included in that space. So the 9 comes with any number of bodies in the area, not just the number of children. So that's a good clarification, and I appreciate that question because it is tricky. It's a little different than our ratio in terms of licensing. This is the state health order, not a licensing issue, and so we have to look at it a little bit differently.
As a reminder, participants wishing to ask live questions can use the Raise My Hand feature on the webinar toolbar. We will call on you in turn and you can ask your question, or you can submit those in writing via our question and answer toolbar. I have another question. Can gatherings of greater than 10 be allowed if the square footage of the facility is large enough to allow 6 feet of separation?
Thanks for that question. So order number 2 does remain in effect, which prohibits gatherings of more than 10 people. So if there is a situation where a person says, I can achieve a gathering that's larger than 10 people with the appropriate social distancing and other requirements, that would have to be submitted through an exception request. So if an individual wants to do that, the mechanism by which they should accomplish that is to submit an exception request through their county health officer for consideration.
This question, if I have a business in Teton County, where would I go to check county variances or exceptions on the new statewide orders for my county? Is there a website, phone number? Who would I contact? Thank you.
Sure, thanks for that question. So I want to look quickly and see where Teton County, if they have their orders posted on their website.
And Stephanie, while you're doing that, I'll address a couple of the questions that have come in that we may not address directly, but I think in a general sense we can address them. And that is, we've had some questions about, if I'm a salon, do I need to submit a plan to the county health officer to reopen? And the answer to that, and Stephanie will nod her head probably, is that no, you don't have to submit a specific plan unless you need to make exceptions to the orders. And so the orders as they are, if you can meet those guidelines, then you can reopen on May 1st or after. So that's a key there. And then the other question has a lot to do with gyms and spaces and space that people have and classes. And I think that what we want to say here is that while we have put out these guidelines that are very general, there are a number of ways that you can creatively do that with your county health officer and go through the exception process. Many gyms are like a big warehouse and you've got a lot of space, and running a class in that scenario may be actually just as safe, but you need to work through your county health officer on that and come up with a plan that is acceptable to them and work through that process that we showed before. So I think that answers a bunch of those questions. And then Stephanie, if you've been able to find the info on Teton County, please share that.
Yes, I did. I actually shared a link in the chat box. It looks like Teton County has their current health orders on a website that lists everything out, their specific health orders, some recommendations from the Teton County Health Officer, and then also a reference to our statewide orders. So there's a website that's very informative and the link is in the chat box.
Excellent. Thanks, Stephanie.
Sure.
We do have a couple of hands up if we'd like to take a live question.
That sounds great.
Rebecca Teague, forgive my name if I spelled it wrong. Rebecca, you are live. Please state your question.
There we go. Can you hear me?
Yes, we can.
I'm curious as to the 9 people and under per space or area. My question is, what is considered a space or an area if a business has more than one room or area?
So I think the key here being that proper social distancing can occur, which is at least 6 feet apart. And so as people are in the space and interacting, you want to make sure that there are 6 feet apart. And so, you know, it may not be specific to the room. Now, we're not talking about childcare in this instance. Is that correct? So I'm going to go with this is not related to childcare. And so the social distancing that needs to take place is at least 6 feet apart from one another, that people can maintain that space while they're interacting. And if there's more to this question, you know, please let me know so we can expand on that.
Okay. Are we asking another question?
Warren, it looks like maybe I need to repost the link, or we can share that out afterwards. I'll put it again in the chat box to make sure folks have that.
Perfect. We'll get that posted. We do have a live raised hand from Christy King. Christy, you are live. Please state your question.
Hi, good morning. Can you hear me?
Yes, we can.
Okay, so my question, I am a gym owner in Cheyenne, and I did have a question about, I have 4,000 square feet of open warehouse space. In the new order, it states if I can have one person per 120 square feet, maintaining that 6 feet social distancing with equipment, why would I still need to get an exception request for that if I'm able to I currently fall under that new order?
So Christy, in that case, you would not need to get an exception request, because you can look at that order and say, I can accomplish all of these things, and therefore you can start operating like that on May 1st.
Perfect. Okay. Thank you very much.
You're welcome.
We have a question on the line from Kathy Emmons. Kathy, you are live. Go ahead and state your question.
Hi, in regard to childcare, if there's a large facility that has smaller rooms within the facility, but they don't have full floor to ceiling walls, is each one of those areas considered a separate room that would have the 10 people limit? Or do we have to look at just as the building as a whole?
Well, Kathy, that is a very good question. Corin, do you have any insight on that? And if not, then Kathy, we can certainly follow up, and we can, you know, have some discussions offline on the question of, you know, half walls and how that may fit into what we're talking about. Corin, do you have any thoughts on that?
Well, from a licensing standpoint, we would defer to the fire inspectors on those kinds of questions, because it's more about a physical space. And typically they don't like half walls. So I think this is one of those situations where we're going to have to look at the fire marshal and the state health order and kind of come up with some balance. So yes, I think Stephanie, Nicole Anderson, and can work with you and Kathy to make that. The issue, I think, is more of a health issue in regard to spread of the virus, and you know, what role do the walls play in that if they're not floor to ceiling. And if I may, Warren, as I see a lot of the questions come in on the chat from childcare, what DFS will do is summarize those in an FAQ and send those out to the childcare providers. We have a listing of all childcare providers that will go through and kind of collect these and answer these, so that people that aren't participating in this presentation also have benefit of the information.
Thank you. We do have one question coming in from the chat box. Can we give more insight and clarification to staff who handle cash or credit cards may not be involved in the preparation, handling, or delivery of food? Is this food ready for consumption, or all food, including meals prepared for cooking at home?
So with this provision, what we're concerned about is that if individuals are handling food or, other payment mechanisms where they may be then transferring that onto the food that's being served. So we really do want to keep those two activities separate. And so whether, regardless of the type, those two activities should be kept separate.
Warren, if you'd allow me to jump in here real quick, one thing I want to mention to folks is that we are coming up on about 5 minutes left in this particular session, and we do have a great number of questions. And as Corin mentioned, what we'll do next is we will all take a look at these questions, separate them out to the different groups that can answer them best, and that way, as Corin mentioned, get them out and also be able to provide them to the folks who came to this webinar. So. Again, great questions. I think we have time to answer a couple more, Warren, if you want to do one live, if that's available, or if you want to pick from this list as well, that'd be great. Thanks.
Absolutely. Anyone wishing to speak live can use the raise your hand feature. We will call on you as time allows. We are getting a number of questions through the chat box regarding the screening of employees, how much time they need to have before they return to work. Can we get some guidance back on that?
Yes, and I'm not sure I'm following the specific question, but if a person has been exposed to someone who has tested positive for COVID-19, they should quarantine for 14 days. So I think if a person is looking for a number of days, and I'm not sure I understand that question fully, but they do need to, part of the screening question would be, have you been around someone who has tested positive or is presumed positive for COVID-19 within the past 14 days? And so it should be greater than 14 days before they're back in a workplace setting. So I hope I've answered that question in the context in which it was asked. And Warren, can I just make a comment to the whole group? This has been very helpful. I hope that people have found the information helpful, but one thing that I want to say is hearing these questions is helpful for us so that we know, what additional guidance may need to be put out, how we can better help individuals to follow through with these orders. And so this has been very informative to us, and I look forward to the other sessions as well, so we can continue to hear what some of those questions are and we can provide guidance and answers to those.
Yeah, and Stephanie, to follow on with that, I think this is a question that we've had in the chat and the Q&A quite a few times, and it has to do with the exact orders that people need to begin to contemplate and make sure that their businesses abide by in the next couple days so that they may open on May 1st or after. And again, just to repeat that, down at the bottom of your screen right now, you should see a link to covid19.wyo.gov/governors-orders. And that website will allow you to read those orders and understand the guidelines that your business needs to meet, again, to reopen on May 1st or after. And that's a key component because it is really important to understand those, make sure that your business meets those, and then you can consider reopening. And so I do want to make sure that everyone knows where that is. I know the slides were a little bit, the text was small and it was difficult to read. So that's where that information is, and you can find the exact orders there.
We do have one live question on the line. Before we get to that, we have received a number of questions about the content of the future sessions. The content will generally follow what we have been sharing with you all today. Of course, the questions that get asked and answered will differ from session to session. Mr. John Miller is on the line. John, if you are live, if you want to go ahead and state your question, please.
Yes. Can you give us a little bit of an idea of what's the process going forward and who's involved to further relax restrictions? I know you said you look at metrics, but is this a daily occurrence? Is the governor involved? But we haven't really heard anything about the overall process. And what's our expectation? Should we expect further relaxation in a week, 2 weeks, a month? We just like a sort of a big general view of that sort of thing.
Sure, John, thank you for that question. So going forward, we are looking at these metrics on a daily basis. We want to take small measured steps to ease restrictions, and we want to put things in place so we can analyze what happened when we took these small measures. And so currently the new statewide orders go into effect on May 1st, and they'll be in effect until May 15th. And so during that time, we'll be looking at the daily metrics, what we're seeing. And then during the course of that time, we'll be evaluating what our next steps are. And we talk with the governor's office about that. We talk with our sister agencies, and we talk with our county officials at the same time. And so these conversations are ongoing, where we're watching things as they develop day to day, and then being able to make recommendations moving forward. You know, if these easing of, if the current set of restrictions that we eased, if that worked, then what is the next step that we can take to see if we can do this next maybe set of things to move forward, and what is the impact of that? And so it is a slow and measured process, and I know that can be somewhat frustrating for everyone, but again, at the same time, we want to balance out you know, the public health needs of our residents, as well as the need for all of us to get back to some semblance of normal.
Yeah, you know, and with that, Stephanie, those are great points. And again, John, great question too, asking about that process. And as I mentioned at the beginning, there are people who are working literally around the clock to figure this out and to keep an eye on this and to really make the best decisions possible. And so we definitely appreciate them, and we appreciate all of you joining in today. We're going to close this session, but a couple things to think about. Right now, it is especially a time to be creative. And it's also a time to be collaborative. And one of the things that we want to do as businesses is work with our business community. So that means other businesses that might be in the same boat, other folks in our community that maybe have come up with some creative solutions to making the public safe and to being able to run their business and balance that lives and livelihoods. I think that now is a time when we want to reach out, not just in your community, but across the state to, you know, other gym owners, other daycares, other businesses that are working through these guidelines, and learn from the best practices. And, you know, as we hear them, we'll bring them out. But I think it is definitely a time to come together and collaborate with with the other businesses around the state and find those best practices so that we can all continue to operate as in a safe manner, but also in a way that we can help our livelihoods and those of our employees. So we want to thank you all today. I want to thank all my panelists for doing such a great job and having some fantastic information and being willing to help on short notice. I also want to thank all of you for not just attending today's webinar, but for doing a really tough job, which is running a small business or a business in Wyoming. It's a challenge. We know that you're facing extreme challenges now, and we just really appreciate your hard work and the fact that you're continuing to move forward with this. So thank you all, and please let others know that we have a number of other webinars this week. Thank you.